Hi friends, I am Dr. Pratap Singh Rathod. I have done MD in Forensic Medicine. In today's video, we will start with CNS depressants. So CNS depressants are a group of agents which cause depression of CNS system. In that, we will mainly discuss about alcohol. So coming to CNS depressants are classified into different compounds, mainly ethyl alcohol, general anesthetics, opioid anesthesiants, sedative hypnotics, which includes the drugs which decreases the activity, moderate excitement and exert a calming effect like barbiturates, benzodiazepines and also other compounds. Inebriants are the compounds which cause intoxications, are the compounds which is under which the alcohol comes. So inebriant poisons produce intoxication, that is lightheadedness, confusion, disorientation, drowsiness. In that examples includes alcohol, barbiturates, chlorohydrates, cannabis, benzodiazepines, paraldehydes, anesthetics, hydrocarbons, formaldehyde, other many pesticides. So these are the drugs which causes form of intoxication, and a person uses he will be in a state of confusion or disorientation. In most cases, there is a recovery after prolonged sleep with some after effects. So whenever the person consumes this type of compound, they usually have some type of they recover from these symptoms. Mainly in alcohol, we call it as hangover. The person goes through a condition of hangover and he recovers after after one day. Alcohol, coming to specifically, we'll discuss in this video about alcohol. So whenever we mention alcohol, it is also called ethyl alcohol or ethanol. So it is a compound which is commonly consumed beverage in different form of beverages. Characteristically, physically, it is a transparent, colorless, volatile liquid having characteristic spirituous odor and a burning taste. Absolute alcohol contains about 99% of alcohol. Rectified spirit consists of 95% alcohol. These are compounds which are not used for beverages. Mainly, it is used in lab. Industrial methylated spirit or denatured alcohol is a mixture of consisting of 95% of alcohol and 5% of wood naphthalene. Come to different source of alcohol. Ethanol, that is produced by fermentation of sugar by yeast. So sugar may be obtained from any form of substrate. It can be obtained from wheat, barley or anything. So whenever the yeast acts on sugar, it causes to release because it forms the alcohol. So alcohol, that is the ethanol. This process stops usually at concentration of about 50%. So whenever the yeast starts degrading sugar at about 50% of alcohol concentration, the alcohol itself starts killing the yeast because of alcohol action on yeast, and because of that the fermentation stops. So because of that, whenever the concentration of whenever fermentation is there, the 50% stops by volume because of that death of the yeast. And usually to increase the concentration of alcohol, they do distillation process which leads to increasing concentration of alcohol in beverages. Alcoholic beverages, which are mixture of alcohol and water with small amounts of congeners, which are simultaneously produced during the fermentation process. So usually alcoholic beverages usually consist of alcohol, water and some congeners. The characteristic flavors of alcohol or beverages are due to organic compounds which are called as congeners, and which includes propyl alcohol, octyl alcohol, glycerin, aldehydes, dimethyl or diethyl esters, acids from forms acids, ketones, trimethylamines, allyl mercaptans, diethyl sulfides, pyroxenes, etc. So these are all different forms of byproducts which are formed in fermentation. Also, they add some form of flavor in case of beverages. So these are all congeners which are present in alcoholic beverages. Then proofs rate is a terminology which is used, which is defined as twice the percentage of alcohol content of any drug. So if there is a weaker spirits, which are termed as underproof, and if there is a stronger spirits, it is called as overproof. The amount of alcohol consumed can be expressed in units, 1 unit being about 8 grams of alcohol. So this is usually terminologies which is used to describe whenever the person consumes a form of alcohol, but it's not universal. Come to concentration of alcohol in beverages. So different beverages have different concentration of alcohol. Vodka being the highest is consists of 60 to 65%, rum liquors 50 to 60%, whiskey, gin, brandy consist of 40 to 45%, porter sherry consists of 20%, wine, champagne 10 to 15%, beers of 4 to 8%. Then one more form of drink which is called as arak is consists of 40 to 50% of alcohol. It is made from distilled from palm rice sugar or jaggery mixed with some other compounds like chlorohydrate, potassium bromide, datura, bhang, which gives extra kick and extra effect of alcohol. So increases the effects of alcohol. So this is a one form of beverage called as arak. So concentration in beverages, a standard drink is roughly about 45 ml of distilled spirits or 15 gram of alcohol, or 155 ml of wine, which consists about 11 gram of alcohol, or 350 ml of beer, that is 13 gram of alcohol. So this is the usually the person consumes the one standard drink consists about these grams of alcohol. So the grams of alcohol in any drink is calculated by different formula. So this is calculated by formula that is volume, that is the amount of alcohol person consumes by alcohol by volume, and density of pure ethanol, it's about 0.789 milligrams per ml. So if you want to concentrate, if the person consumes any form of beverage, like for example in this example like beer, so if the person consumes beer about 350 ml, if we assume 350 ml person consumed, and we assume that beer, from the last video we discussed about beer consists 4 to 8% of alcohol. So 4 to 8% comes to about 5% if we take roughly. Then grams of alcohol when consumed includes to 350, that is the ml consumed. 5 by 100, 5 divided by 100, that is the 5% comes to about 0.05 is the alcohol weight by alcohol by volume, that is per ml how many volume is present, into 0.789, which is density of ethanol in liquids, that comes to about 13.808 grams of pure grams of alcohol present in the beverage. So this is useful to calculating the blood alcohol concentration. Blood alcohol concentration is very useful. So this is if the person has how many drinks, how many types, different types, if you is available, we can calculate the, by calculating the grams of alcohol, we can calculate the blood alcohol concentration, which can be derived from Wiedemark's formula. Then 200 grams of alcohol in men and 140 grams of alcohol in women per week is considered as safe limits for drinking if liver damage to be avoided. So by calculating by 210 grams of alcohol per week, so in 1 week if the person consumes less than 200 grams, for in males and 140 grams less than in, usually it doesn't cause the liver damage. Coming to absorption of alcohol, alcohol requires no digestion prior to absorption. It is readily absorbed. Its smaller molecular size permits to pass readily through membranes by simple diffusion. A small amount is absorbed from mouth and esophagus and can be easily absorbed. About 20% is absorbed from stomach, 80% through small intestine. The maximum concentration in blood is reached within 45 to 90 minutes after ingestion, with majority of persons reaching their maximum in 1 hour of ingestion. So usually within 45 minutes to 90 minutes, or roughly about 60 minutes, the concentration reaches way high. Intoxication by inhaling alcohol vapor is unlikely, since it is eliminated more rapidly than it is absorbed by this route. So usually alcohol is very volatile, so by air it is not absorbed easily, and because it get easily diffused, it is not easily absorbed. Alcohol is also poorly absorbed through skin. If it is present on the skin also, it doesn't easily absorb, since it is very volatile and it evaporates easily. Some factors which influence the absorption: if the person has consumed alcohol with carbonated drinks like usually soda, which hastens the absorption because bubbles greatly increase the surface area carrying the alcohol. Next is the food delays. If the person consumes alcohol with food, it delays its absorption, and the delay is mostly marked in presence of fat or proteins. If there is rich in fat, and if the food is rich in fat and proteins, it delays the absorption. If the person consumes with warm drinks, which dilutes the gastric mucosa capillaries, then are more quickly absorbed than ice drinks of the same brand. So if the person consumed with warm drinks, then it is easily absorbed. Then ice, which causes decrease vasoconstriction, then it will decrease in absorption. Persons with achlorhydria or chronic gastritis have slower absorption rates. Lower or higher concentrations are absorbed more slowly, absorption rapid concentration of 10 to 15%. So as the concentration of alcohol increases, like if the person consumes vodka or like any other whiskey where the concentration is about 40 to 60%, then alcohol will be absorbed more rapidly. Habituated heavy drinkers absorb alcohol more rapidly than abstainers. So if the person is first time drinker or habitual, then the person habituated drinkers have absorbed alcohol more rapidly compared to abstinence. And certain drugs like benzene, atropine slow the rate of absorption of alcohol. Coming to distribution of alcohol, once the body it absorbs, it is evenly alcohol it get distributed. Alcohol is lost from blood to the tissues in proportion to the water content of the tissues with which it comes in contact. So alcohol requires water for distribution. So alcohol plus any tissue where it is water is present, it gets easily distributed till equilibrium is reached between the blood and the tissues, except in adipose tissue as ethanol is insoluble in water. So to distribute alcohol, it requires water content. So if any tissue, if there is water, it will get easily absorbed, but it is insoluble in water, so it is not present in adipose tissue. Some alcohol is lost by diffusion into the alveolar air as the arterial blood passes through the lungs. So once the alcohol reaches blood, it can be easily distributed throughout the body, and it is some it is expired through air, alveolar air. Red cell contains less alcohol than plasma, so that the whole blood concentration is slightly less than that in separated plasma serum. So if we take a whole blood which consists of RBC plus plasma, so our concentration of alcohol in RBC will be less compared to plasma, which will be have higher concentration of alcohol. So since albumic has less alcohol than plasma, and the whole concentration will be very less compared to that of separated. So whenever alcohol is measured, it is usually measured in whole blood plasma, so that concentration will be accepted. If only plasma is there, then the concentration will be more compared to whole blood, and it will be in RBC it will be less. A given intake of alcohol would produce a higher blood alcohol level in obese persons as compared to lean persons of the same weight as aqueous compartment is small. So if in obese person, if the same amount is consumed, the alcohol concentration will be less because the aqueous compartment is less. For the same reason also there are some reasons where because of decreasing aqueous compartment in females also it affects. A smaller volume of distribution of ethanol in women, a more variable absorption, a lower ADH enzyme, a faster hepatic clearance, a higher concentration of acetaldehyde, and poor solubility in body fat are some physiological factors due to which females of the same body weight will have higher, that is 25% higher blood alcohol concentration for the same amount of drink as their aqueous compartment is smaller. So in female there are three reasons. One is different reasons is variable absorption. So in alcohol it is variably absorbed. Then there is decrease in ADH enzyme in females. Then there is a faster hepatic clearance will be present and higher concentration of acetaldehyde. These all reasons contribute. Then body fat is also poor body solubility in body fat also causes the in female that alcohol concentration will be 25% larger compared to in males for taking the same amount of alcohol. Ethanol is distributed even throughout the body water, passing the blood-brain barrier easily and bathes nervous via the cerebral extracellular fluid. So it is again it is easily distributed and it is absorbs. It enters the CSF and it enters the brain. Venous blood alcohol in the absorption phase is about 10% lower than the arterial blood. So if you compare venous and arterial blood, in venous blood absorption will be less 10% than compared to arterial blood. This accounts for higher concentration of alcohol in alveolar breath compared to that of venous blood. Equilibrium in muscles may require 1 to 2 hours. So within 1 to 2 hours, the alcohol concentration will be same in even in the muscle tissue also. It will be equilibrium will be achieved. Coming to relative concentration of alcohol, if we take a relative concentration in different fluids, whole blood it will be, if compared is 1, then in plasma it will be more since it will be concentrated, but in RBCs as I mentioned it will be less compared to whole blood. In brain it will be 0.5, 0.85. In spinal fluid, because it is rich in water, so the concentration will be more 1.1 to 1.27. Similar is in vitreous also it will be 1.2. Urine it is 1.3, it is more slightly more. Liver it is 0.85 and liver it is 0.021. So these are different ratio of concentration whenever the blood is absorbed and distributed in the different ratios. Coming to excretion, alcohol is excreted through all the routes of excretion. About 5% of ingested alcohol is excreted in the breath and about 5% in the urine. Negligible amounts are excreted in the sweat, saliva, milk, tears and feces. So usually it is metabolized in liver. From liver it is excreted in different routes, mainly in the breath and the urine it is usually excreted. It is also excreted in sweat, saliva and milk, tears and feces. So if it is because of it is secreted in sweat, the person who has consumed alcohol will have a peculiar smell of alcohol will be present. Metabolism, about 90% of alcohol is absorbed, oxidized in the liver and remaining 10% is excreted. So in alcohol in liver, alcohol is oxidized by enzyme acetaldehyde by converted to acetaldehyde by ADH that is alcohol dehydrogenase enzyme, which leads to aldehyde formation. This aldehyde is acted by again by nicotinamide DNA nucleotide which to acetic acid. Aldehyde is acted by again by alcohol dehydrogenase enzyme, which leads to acetic acid and plus carbon dioxide is released. In the second phase, aldehyde is transformed into free acetic acid and its active form acetyl coenzyme A. Finally, the acetate esters the general pool and undergoes oxidation to carbon dioxide and water and citric acid, that is Krebs cycle. Acetate can form glycogen, proteins and possibly fats and cholesterol. So acetate which is released, so this is the main reason because it can be stored, converted, it can form glycogen or it can sometimes can also be useful for protein formation or also possible fat, which leads to which increasing in consumption may also cause fatty liver or cirrhosis. It disappears from the blood at fairly uniform rate about 10 to 15 ml per hour. Chronic alcoholics are able to metabolize alcohol at higher, faster rate about 30 to 40 milligram per 100 ml per hour until they develop severe liver damage. So initially, if the person is chronic alcoholic, they can metabolize up to 30 to 40 ml per ml per hour. Usually, normally it is 10 to 15 ml per hour it is metabolized. Coming to action of alcohol, alcohol is a well-known stimulant, but in selective depressant, especially higher nervous system centers, which it inhibits. So it usually causes stimulation, but it selectively causes depression of higher nervous systems. Ethanol depresses primary reticular activating system, which is responsible for coordination of muscles and coordination of hands and legs. The frontal lobes are sensitive to low concentration, resulting in mood changes, followed by occipital lobe, resulting in visual disturbance and cerebellum loss of coordination. So effect of alcohol in frontal lobe leads to mood swings, difference in mood. Effect on occipital lobe leads to visual acuity and visual disturbance. Effect on cerebellum leads to loss of coordination. So based on higher centers, action on higher centers, the changes occurs. It causes depression of more specialized and sensitive cells of cerebral cortex, conduct, judgment and self-criticism, which is responsible for conduct, judgment and self-criticism. Because of that, the person is unable to judge properly any situation. Finally, the vital centers in the midbrain and medulla, which are responsible for respiratory centers, which may cause death from cardiorespiratory failure. So because it's effect on midbrain, which has respiratory centers, the person usually dies because of respiratory arrest. It causes generalized vasodilatation, especially in the skin, and may increase hemorrhages from literally minor injuries. It causes diaphoresis, that is increase in sweating. It can cause tachycardia. Initially, it causes increase in heart rate. Later on, it can cause decrease in heart rate, bradycardia can be loss. Then there will be salivation and diuresis may be seen. It creates a sensation of warmth but increases the heat loss. Spirituous liquors or any on the empty stomach can cause severe, even hemorrhagic gastritis and hypoglycemia. If the person consumes, there is chances that there may be chances increase in hemorrhage may also occur. Some toxic effects. Ethanol has a toxic effects on almost every organ system. Effects of acetaldehyde are to change in the redox potential of cells. The metabolism blocks the drugs such as aspirin, opioids, benzodiazepines, barbiturates, dioxin, antidepressant, phenytoin. So alcohol blocks the metabolism of certain this type of drugs. It has also synergistic effects with other sedative hypnotic drugs, which leads to increase in effect of drugs like barbiturates. If the person consumes barbiturates, benzodiazepines with alcohol, then the effect of barbiturates increases. Even one little dose can cause severe side effects will be affected because of synergistic effect. Coming to cause of death in alcohol consumption, death is caused either by direct depressive effects upon the brain stem or due to aspiration of vomit. So it can cause CNS depression, or because of depression of CNS, the person may regurgitate the vomit and aspirate the vomit and die. Death due to acute overdose of alcohol are not common, but death due to chronic effects of alcohol are common. So usually because of chronic effect of alcohol, the person there is multi-organ failure occurs. So because it has toxic effects in different organs, so multi-organ damage occurs, and usually the person dies because of chronic effect of alcohol rather than the acute effect of alcohol. Death with alcohol blood concentration below 400 mg/% may occur in persons with chronic debilitating diseases, especially severe atherosclerotic heart disease, pulmonary emphysema, and varying degrees of hypoxia. Since if the concentration is less than 400 mg/%, usually if he dies, it is mainly because of if any he has other additional diseases like atherosclerotic heart disease, emphysema, hypoxia. Coming to signs and symptoms of acute alcohol poisoning. If the person has consumed he's first time drinker and he's acute alcoholic consume lot excessive, it may lead to acute alcoholic poisoning. So whenever the person consumes, it passes into three phases of intoxication based on how much concentration is present: stage of excitement, stage of incoordination, stage of coma. Coming to stage of excitement, it is seen when it is concentration, blood concentration is less than 150 mg/%. So 150 mg/% or 150 mg is roughly about 150 mg per dl, that is deciliter of alcohol if present, the concentration occurs. So if you are when 150 milligram is the which if present, then this signs is present. In this, first the person feels feeling of well-being and certain slight excitement is present. The actions, speech and emotions are less restrained. There is an increased confidence and lack of self-control, disclosure of secrets. Normal good manners are forgotten. The neat and orderly are careless in their dress. First the person starts behave like well-being. He get excited, starts talking. Emotion is less restrained. He can disclose, self-control is lost, disclose secrets, and mannerism is lost. At 30 mg/%, impairment of cognitive functions occurs. Motor coordination, sensory perception decreases occurs. Beyond 15 mg/%, slurring of speech, unsteadiness, drowsiness, impaired reasoning and memory loss occurs. Reduced perception and decreased concentration occurs, and reduced visual acuity. So beyond, as the concentration increases, there is slurring of speech, which is an indication of incoordination. So person early stage of incoordination will be present if the person cannot be able to speak. Unsteadiness, drowsiness, impaired reasoning, reduced perception, and reduced visual acuity occurs. Then significance of judgment and motor coordination control occurs at 25 to 15 mg/%. The person is unable to judge anything. Reaction type of injury becomes impaired at 50 mg/%. It alters time and space of perception. The person is unable to understand the time where he is present or wherever he is there. Then the pupils becomes dilated. There is definitely deterioration in driving ability occurs at around 15 mg/%. The person is not able to drive properly because of lack of reaction time. Between 50 to 100 mg/%, there is loss of inhibition, loquaciousness is present, and laughter starts to occur. There is slurred speech, unsteadiness and nausea seen between 100 to 150 mg/%. Between 40 to 100 mg/%, there is alcohol gaze or nystagmus is present. So nystagmus is the to and fro movement of the eyes. So if there is a to and fro right and left movement is present, which is seen in the nystagmus is seen. But in alcohol gas nystagmus, there is jerking movements in the direction of the gas. So if the person is seeing in this direction, then there is nystagmus will be present in this nystagmus. So the eyes will be moving in the to and fro, there is moving in this direction wherever the person gaze is present. Recall memory is often markedly disturbed, and the person is not able to recall his name or his relative friend's name. They be able to not be able to recall. Sensitivity to pain is decreased at about 80 mg%. Alcohol will increase the desire of the person to desire sex, but markedly impairs the performance of sex at around 80 mg%. Next stage of incoordination, which starts from 150 to 250 mg%. Here the sense of perception and skill movements are affected. The person starts losing his skill movements. He becomes carefree, cheerful, ill-tempered, irritable, excitable, quarrelsome, and sleepy. There is certain clumsiness and incoordination in the fine and more skilled movements. The person is unable to perform fine movements like picking up any small objects, buttoning, unbuttoning. So this small fine movements are unable to do. He becomes clumsy. There is nausea, vomiting present. The face is flushed and pulse is rapid. Sense of touch, taste, smell, and hearing are diminished. Temperature becomes subnormal. Heart rate increases. Motor and sensory cells are deeply affected at stage of coma, which is about more than 300 mg%. So in around more than 300%, this person goes in stage of coma, where the motor and sensory cells are affected. Speech becomes thick and slurring. Coordination is markedly affected, causing the patient to become giddy, stagger, and possibly to fall. The person passes to state of coma and with stertorous breathing. The pulse is rapid and temperature is subnormal. The pupils are contracted. So previously in stage of first stage, the pupils are dilated. Later on it becomes contracted. But simulation of the person by pinching or slapping causes them to dilate and slowly return, which is called as Mick-Evans sign. So in Mick-Evans sign, if pupils are usually contracted, but if stimulation is given like slapping or pinching, the pupils will slowly return to dilate and slowly return to normal. With recovery, the coma gradually lightens into deep sleep, and the patient usually recovers in 8 to 10 hours and wakes up with acute depression, nausea, abdominal discomfort, irritability, lethargy, severe headache, which is the signs of hangover. So even if the person goes in coma, he may gradually recover about 8 to 10 hours with some side effects of depression, nausea, abdominal discomfort, and irritability, but usually he will recover. If coma continues for more than 5 hours, the prognosis is likely to be worse and death is usually results. That occurs because of asphyxia due to respiratory paralysis, but it may also occur from shock. Prolonged coma due to alcohol may cause irreversible hypoxic brain damage and death. In such cases, blood alcohol level is usually low. So in prolonged coma, because the alcohol level is present, it is slowly metabolized, so alcohol concentration will be low, but there is irreversible hypoxic brain damage may occur. Fetal dose of alcohol is 200 to 250 ml of absolute alcohol consumed in 1 hour. So different beverages have different fetal dose, but usually around 400 mg%, more than 400%, if the person alcohol blood alcohol concentration is present, it is fatal. Fatal period is 12 to 24 hours. Consent for examination. In case of early alcohol poisoning, if the person has consent, he is coma, consent, the question of consent arises because usually he is unconscious. If the person is unconscious, otherwise not in the fit condition to give consent, since alcohol impairs the mental stability, so it is very difficult to obtain consent. Doctor is called by police to examine, should not disclose the police any information he obtained during the examination, but could wait to get consent for the patient when he regains consciousness or is fit condition to be asked. So the person can be examined by the doctor, but the findings should not be disclosed to police officers. So usually if the alcoholic is brought for examination, then the doctor can examine, but it should not be disclosed. Person can be examined without consent if it is required by sub-inspector of police. So on the request of police, even the alcoholic can be examined without consent also. Coming to treatment of alcoholic poisoning, first is evacuation by stomach and bowel wash, gastric lavage with alkaline solution usually to remove the poison, remove the alcohol. If any alcohol is present, it is removed by gastric lavage. The patient must be kept warm, and if there is a congestion of the brain, ice bags should be applied to the head. 1 liter of normal saline with 10% glucose, 100 mg of thiamine, and 15 ml of insulin are useful. Usually, since alcohol decreases the glucose concentration, glucose is useful. And chronic alcoholics, it impairs thiamine absorption, so thiamine is also provided. So in a chronic alcoholic, thiamine is decreased, so it impairs the absorption, so thiamine is provided. And also insulin is given for absorption of glucose. If the coma deepens, nerve stimulants such as caffeine and strychnine should be used, and artificial respiration if there is difficulty in breathing. Inhalation of oxygen is of great value. Hemodialysis of patent is also very helpful to remove alcohol. Come to post-mortem appearance. If the person dies because of acute poisoning, so changes will occur. On opening the cavities of the body, alcoholic odor is frequently present. So typical odor of alcohol is noted. Acute inflammation of stomach with coating of mucosa is commonly found. The brain, liver and lungs are congested, and the smell of alcohol in viscera is noted. The blood is usually fluid and dark in color. Edema of the congestion of the brain and meninges and cloudy swelling of pancreatitis organs are present seen. So since the person dies mainly because of asphyxia, signs of asphyxia are present. That is, congestion of organs will be present. So brain, liver, kidney will be congested. Then there will be particular hemorrhages are usually not seen. Then cyanosis may be seen in the nail beds can be present. Coming to chronic alcoholic poisoning, this occurs in the person consuming a small amount of alcohol for longer duration. Usually there is multi-organ failure occurs. Alcoholic addicts are the people who cannot stop drinking for long or who experience withdrawal symptoms if they do. So the chronic alcoholics include chronic addicts and alcoholics. It results in impaired social and occupational functioning. So addicts are the person who cannot stop drinking even though they know that because of alcohol their social life is lost, but they cannot stop, and they get withdrawal symptoms because of that they do not do. Then there are chronic alcoholics also present, are those who have reached a state of more or less irreversible somatic or brain changes caused by alcohol. So in chronic poisoning there is addicts who cannot stop alcohol, and one more is the chronic alcoholics who there is also which cause because of chronic consumption of alcohol has caused the damage in the organs. The patient suffers from nausea, vomiting, anorexia, diarrhea, jaundice, tremors of tongue, hands, insomnia, loss of memory, impaired power of judgment, hypoproteinemia, and general anesthesia. So even the person has not consumed the alcohol, because of chronic effect of alcohol, the person has some symptoms like tremors will be present. The person is impairment judgment is present. There may be anasarca is present. So these are symptoms are seen even though the person may not be consuming, and because of chronic consumption these signs will be present. The symptoms of peripheral neuritis and dementia occurs in the last stages. Such patients generally die suddenly from coma. In chronic alcoholic post-mortem appearance, signs of malnutrition may be present, mainly the malnutrition present. Gastric mucosa membrane is deep reddish brown with patches of congestion, effusion is hypertrophied. Liver is congested and show fatty infiltration, enlarged, and weight may exceed up to 2 kg and may be cirrhotic also present. So liver typical changes of the chronic alcoholic present, it may be fatty liver or it may be cirrhotic, it may be present, it may be seen. The kidneys show granular degenerations, heart is dilated and show fatty degeneration and patchy fibrosis. There is typical shrinkage of cerebral cortex and visual accumulation of fluid which causes wet brain, which is seen in chronic alcoholics. Treatment for chronic alcoholism, it is usually given to withdrawal disulfiram. It is given in single daily dose of 250 mg. It inhibits the aldehyde dehydrogenase. So because it inhibits aldehyde dehydrogenase, alcohol once is not metabolized properly. One more drug is antabuse, which is titramine disulfide, which inhibits the biotransformation of ethanol beyond the acetaldehyde, leading to accumulation of acetaldehyde. So because of antabuse, once acetaldehyde is formed, acetaldehyde starts accumulating in the blood. So this accumulation causes unpleasant symptoms such as flushing, palpitation, anxiety, sweating, headache, abdominal cramps, nausea, vomiting, due to which the patient dislikes the alcohol. So antabuse is usually combined with is given in the person, and when the person consumes in presence of alcohol, he experiences some unpleasant symptoms. Because of that, he starts disliking alcohol and stops drinking. Then other treatment includes calcium carbide 15 mg once a day, which uses less side effects. Chlorprazam 25 mg 4 to 6 hours also useful. Chloroidine 61 mg per hour is also given, or chromethazine is also useful. Some condition reflex treatment is also tried, where it comes giving alcohol beverages together with some drugs that cause immediate or acute nausea, vomiting. About in this, there is 5 to 8 daily treatments. Symptoms are brought on simple by sight of bottle, and the patient begins mentally or associated with painful sickness with alcohol. So alcohol is given with any drugs which causes nausea and vomiting. So it is a form of conditioned treatment where the person believes that whenever they consumes alcohol, there will be nausea and vomiting will be present. So 5 to 8 treatments is provided, so that he associate alcohol with such symptoms. Then hypnosis treatment or psychotherapy is also provided to uh, prevent the person to become stop alcohol consumption. Then Anonymous is one of the international voluntary organizations which provides form of counseling. Here, addicts who are desirous to give up alcohol narrate their bad experience to other alcoholics through group meetings, letters, press, and other media. And because of sharing of the information, they start counseling and they stop the alcohol. These are my references. Thank you.